Hello, and welcome to Heart Senses The Pulse, where we tackle pressing issues in healthcare. Today, we will discuss the effects of heart health in connection with diabetes and learn more about preventative cardiovascular care. I am joined today by our co-founder, Dr. Antoine Keller, and our special guest, Preventative Integrative Cardiologist at Minneapolis Heart Institute Foundation and health equity activist, Dr. Courtney Jordan Baechler. Dr. Jordan Baechler and Dr. Keller, welcome, and thank you so much for joining me today.
Thank you, Sabrina. I want to let you know that Dr. Jordan Baechler is one of my favorite people in community medicine and activism because she has done a number of programs with me before and always has very insightful comments. So I'm really looking forward to hearing how she handles your questions.
Well, thank you. That's quite the introduction. I'm glad to be here with you, and I share the same respect and admiration for the work that you're doing, Dr. Keller.
Thank you very much. We're a good team.
You are. Yeah. I mean, I've had the distinct pleasure of seeing Dr. Keller and Dr. Jordan Baechler in action in one of their recent talks in Baton Rouge. So I'm looking forward to today's conversation.
Good. Let's get it. Let's go.
All right, let's go.
As we say in Louisiana.
So, Dr. Jordan Baechler, how did you first hear about HeartSense?
You know, I had the great opportunity to learn about some of the incredible work you're doing when Dr. Keller and I were connected through Edwards Life Science and some mutual interest in improving outcomes in aortic valve disease, specifically around racial disparities. And it was really exciting to see what amazing work you guys have done throughout the pandemic and through these really difficult times to get the word out and get action-oriented pieces to the community.
Very nice. And do you have like-minded organizations where you are at in Minneapolis that focuses on kind of that heart health, health equity aspect that we take with HeartSense?
Yeah, so it's been interesting, you know, as you guys are probably all aware of, after the murder of George Floyd, many things became much more front of mind around the disparities that we see in all sorts of ways in Minneapolis and the surrounding area, from police brutality and education, but certainly health outcomes. And so I would say we have a lot of organizations that have made declaration statements locally. There needs to be a lot more action yet. So I am proud of the work that we're doing in partnership with community organizations, not as much healthcare direct organizations, but we've partnered with Insight News, which is a Black newspaper that was started by Al McFarland and has been around for 4 decades. It's a trusted news source, which has become a trusted source of information, period, where we've partnered around health that way. And we've partnered with the YMCA locally here, again, really tried to build upon organizations that have deep roots in the community and be a more trusted partner in that regard as a health source. But slow, steady, patient has been the name of that game, recognizing, as you guys know well, to undo some of the challenges that have been here historically takes a lot of time, and not always your first interest and effort. You know, you, as you guys know, you go out trying to enroll someone in a study because you're excited about that, if it's not there with the community.
Well, you know, that brings to mind a very interesting question to me. Of all of the things that you've done, and we could take the whole time talking about all the different programs that you guys have, but of all of the programs that you have done, which one do you think has had the biggest impact on the community and why?
Wow, that is a really good question. I'll tell you the one that I'm most excited about right now that we're just getting launched. We are partnering with a local church up here in North Minneapolis, which is where we see some of the largest disparities. And part of what we're doing is creating office hours. And this came, and I know that you will know this well, Dr. Keller. So how many times do you run into somebody at your kid's school? Hey, I've been having palpitations, oh, I'm worried, I've been having chest pain, and you sort of fast track that person into your clinic to the right tests. It happens all the time.
It does.
And as we talk about access being such a big social determinant of health, and it is, but I think part of what we need to do is kind of break that down. And part of what I've realized is oftentimes what wealthier, more commonly white people have than oftentimes more challenged, sometimes people of color, is more access to physicians, period, and that fast tracking. And you can have my same add-on flat. So we're trying to bring that to the community, and we have just launched this where we're having routine office hours each week to just have conversation and casual conversation that you're not being billed for, but to, one, bridge trust, two, improve access, and have that kind of access that other people have to say, yep, that is something that you need to be seen for really soon. And here's a track in to get you that. Or like the call I got from my brother this morning, whose dear friend fell and passed out. And I was like, yeah, you're good. Like, I think maybe that was alcohol related or something else. And I think this person doesn't need to go in. But, sometimes you need that little nudge with somebody that you trust that shows up after week. So, and then some of the pieces out there in terms of screening that will be that next step. But I think there's something to that,
Yes, absolutely. And this is a really important point, Sabrina, that reminds me of something my daddy used to say. He said, not everything that can be counted counts, and not everything that counts can be counted. Now, I believe it's a Mark Twain quote, but the emphasis on not everything that counts can be counted is really apropos to today, which is National Diabetes Awareness Day, and to taking care of people with chronic disease in general. Because there are so many things that they do on a daily basis, things that come up with them on a daily basis that aren't going to show up when they go to their doctor. They need advice, they need counseling. Sometimes they just need a kind word and support to be able to stay on the right path. And it's so important what you're doing, because it gives them a relationship with someone who has evidence-based knowledge, more than what they can find on the internet or in Instagram, and somebody who they can trust. And it really does go a long way to reducing the amount of hesitancy people in the community have towards physicians and towards medicine in general. So I applaud you for that. And I think it's the right way to go, just to be able to touch people. So thank you.
Yeah, thank you. I appreciate that. I think that there's a lot to be said. Just yesterday when we were meeting with folks, some of the usual things that you hear a lot of times. I think this happens with diabetes and high blood pressure all the time. When there are things that you don't feel, particularly in the beginning, sometimes people have the perception that then you don't need to take that medicine every day that lasts for 24 hours. And this is something we come up with again and again. And anyway, so there was a lot of questions and just honest comments of, I only take that when I feel this way. On one of our podcasts, we had somebody around diabetes, and same thing. It takes a lot to sometimes have people be aware of what's going on with blood sugar.
Yes. Sure. And there's so many misconceptions and opinions that are not evidence-based that are floating around in the community. And to just not to focus, well, actually, indeed, to focus on diabetes, since this is one of the things that is at the top of our minds today because of the actual day that we're doing the taping. There are a lot of myths and misconceptions about diabetes that people pass on from one to the other that can certainly have an impact on someone's livelihood and their longevity. And I'll give you some examples. I would like to play rapid fire questions with you. Like, I have heard, I'm a heart surgeon, so I see people at the end of the road. They don't want to see me, but then they realize I'm really trying to give them information that they can use to try to prevent them from coming to see me. Then it makes it a little bit better. But there are a lot of people who think that nobody in their family has diabetes, so they're not going to get diabetes. They can do whatever they need to do. Can you comment about that?
Yes, I'm going to say that one is false. I feel like I need a buzzer, you know, to be like,
Yeah, you need a buzzer. Sabrina, let's get a buzzer next time, okay?
Buzzer. Okay, I'll do a buzzer next time. Yes.
I love it. But yeah,
Okay.
unfortunately, as you guys know, we are seeing the highest levels of diabetes that we've ever seen. And while there is some propensity, if you already have it in your family, that you're potentially more likely, we definitely see first time ever folks getting diabetes. And, you know, with upwards of 50-60% now of adults having an impaired high blood sugar. So somewhere on that trajectory of moving towards diabetes. The other thing I would just throw in for your listeners is so many people do not realize that having high blood sugar while pregnant or gestational diabetes is a huge risk factor. One, increases your risk of developing heart disease by 4-fold, but two, increases your risk of developing diabetes in general. So that we just looked at our own data in Minneapolis this last summer, and 25% or something of our patients who had been identified as having high blood sugar during their pregnancy did not ever get that rechecked afterwards. And so we know, these risk factors are developing really, really early in life and not being mitigated down.
Yes. And, you talk about risk factors for diabetes, and there are a number of risk factors, which I'll let you go into in a minute. But, I have patients coming to my office all the time asking me if diabetes runs in families. And obviously, there is some genetic predisposition to developing diabetes. But I've had a friend when I was in training says that no, diabetes doesn't run in families. It's because nobody runs in the family that they have diabetes. So,
I like that.
So obesity and sedentary lifestyle are pretty significant risk factors for developing diabetes. And, a lot of people think that you can get diabetes from eating too much sugar, but it's not actually the sugar that gives you diabetes. It's being overweight that results from eating the sugar that gives you diabetes. So please expound upon your message to people about the likelihood of developing diabetes when you have certain risk factors, and what you can do to try to keep that from being an eventuality for you.
Yeah, I always emphasize, especially in prevention, that, part of it depends on how far along we are on this trajectory. All of these things are going to be helpful at mitigating. If you're far down and you have clearly established high blood sugar and diabetes, then it's time for medications. It's still, if you get good sleep, you treat sleep apnea, you move your body, which can be as easy as walking and ideally getting, any exercise in, but up to that goal. Steps a day. You're eating a diet that is complex with good plant-based fats, ideally plant-based proteins and complex carbohydrates in each meal.
Tell me about those. What are those? Complex carbohydrates?
Yeah, complex carbohydrates and plant-based fats and proteins. So if we think about carbohydrates, we're going to want to be thinking about brown rice, quinoa, some of those more ancient grains that you might hear people talking about when we think about pasta, having it be durum wheat, things that have both fiber and the carbohydrate. So really wanting to avoid just that straight up white sugar in white bread or, really basic pastas or minute rice, those types of things that are easy for our body to break down, turn into that sugar faster, and sort of, to your point, make it difficult to outrun or out exercise that when we're having those. And that's where having those good fats really make a difference. Avocados, nuts, olives, olive oils, with every meal. I think we did a disservice over the years emphasizing fat-free diets, which actually are not really helped increase the level of diabetes that we see. So can't always be fat from animal-based sources, but those plant-based ones are really good source to go through. But all of those things are going to help bring down your blood sugar levels and make a big difference.
Yeah.
Very good.
So I just want to jump in and just kind of note for the community one of an interesting fact that I found from American Heart Association, that fewer than 1 in 5 adults with type 2 diabetes who are not diagnosed with a heart disease, they have healthy levels of blood sugar, blood pressure, and cholesterol, and they don't smoke. So can we just kind of talk about that a little bit, especially in the preventative cardiology world, Dr. Jordan Baechler?
Yeah, and you mean just in terms of ultimately their risk of developing heart disease, then? Is that kind of your question there?
So what is how does that work, that risk that they have with diabetes, even though they're not really noticing it from any type of side effects in their health?
Yeah. So really good point, Sabrina. Yeah, the tricky piece is, right, in general, what people die from with diabetes is ultimately the development of cardiovascular disease. And so, like you're saying, they may not have some of these other risk factors for developing heart disease, but diabetes itself unfortunately makes everything so inflamed and likely then to develop plaque, which then is basically the basis of heart disease. So it's a significant problem that way.
Oh, wow. Okay.
And tell us, if you wouldn't mind, about prediabetes. And is all hope lost when I develop prediabetes, or is it possible to recover from that and not eventually get diabetes?
Yeah, so really great question. Just like having high blood sugar when you're pregnant, prediabetes, you can get that at any point in your life, and that can be reversible. So that's like that critical time to get out and be moving our body more, thinking about how much activity we're getting, ultimately losing weight, eating different foods, and sleep. It's really difficult for people to lose weight if they're having impaired sleep. And so this is where we got to think about sleep apnea, good sleep hygiene, all those things. If you're walking around like a zombie the next day, it's impossible. And then, stress plays a big role in this too. And that's where something that helps calm also decreases that inflammatory response, those blood sugar levels. But so again, at that point, it's that critical time where this process can be reversed.
Yeah, and I think you hit on a really good point about mental health and stress, because stress is a surrogate for a lot of other things that aren't necessarily good for you. It brings along with it overeating and sedentary lifestyle and hypertension and all of these other things that really aren't very good for you. And so a lot of times, if you can alleviate the stress, or at least find a way to be able to manage the stress, it can have a significant impact on your propensity to develop these kinds of chronic problems that we see as promoting cardiovascular disease.
Absolutely. yeah, there was just another really good trial at the American Heart Association on mindfulness-based stress reduction. And, there's all sorts of variations to this stuff now. You can see things helping reduce stress with as little as 5 to 10 minutes of calm thoughts, meditation, sometimes prayer, depends on what it is for people, but that really then helps slow that fight or flight response that is part of what is driving these blood sugar responses and some of that inflammation.
So you've
And
also
you've referred,
mentioned, sorry, go ahead. Do you have
please go ahead,
okay.
Sabrina.
We were talking in a way about culture and cultural disparities right now. And I was just wondering, since we are getting closer to the holidays, are there some things to keep in mind within, as we celebrate in November and December, all these beautiful cultures, but what to keep in mind for like preventative concepts of eating or drinking? Like, how does that tie into our community's celebrations?
Here's what I would say, and honestly, what I tell myself, you guys have maybe heard this before, but the most that your body experiences in terms of joy is in those first 3 bites of any type of drink. So I try to remind myself that like Thanksgiving's going to come around again. These parties are going to come around, and it's not kind of your last time having cheesy potatoes or whatever it is.
Yeah.
So I think there's all sorts of cultural modifications that if someone chooses can be made long term if it's something that you're having every single day, and that's kind of a different story of like how much salt we put in things, how we prepare things. But for holidays that don't happen too much, I think the biggest thing is everything in moderation. As Americans, we could probably get a lot further in life if we didn't kind of supersize things every time we see it. That's our tendency. We're all told
it's
that.
true. Yeah. For me, it's that sweet potato casserole. So the most important thing, though, I think, is just to emphasize is portion control is really important. And if you can have all of those things and cheat every now and then if you need to on holidays and so forth. But if you cut everything you eat in half, then you will have a significant impact on how that affects you and your blood sugar and your hypertension and all these other things that eating all of these things can sometimes promote.
The other thing to keep in mind, just I think for the listeners long term, is the time of day, right? This is such a hard one. But on a, what would I say, Sunday through Thursday basis, if these are routine meals, I don't know about you guys, but I very much try to be cognizant of what I'm having after 7 o'clock. And this whole intermittent fasting thing that's trendy, nobody needs to, really intermittently fast. However, the basis of that, of having a solid 12 hours that your body's not eating is critical, especially for the pancreas to be able to have some insulin sensitivity. And so, like everything happens now, you've got people fasting for days and days and days. That's not necessary, but having a good 12 hours where you're not putting food in your mouth, which is rare for a lot of people to not be having, popcorn and a glass of wine at 10 o'clock at night or whatever it is,
Right.
Sure.
That's right. And tell me about alcohol.
Yep, the truth be told. So alcohol, no matter what it is, as it breaks down, turns into carbohydrates, which turns into sugar, which makes our pancreas have to work harder and increases our risk of developing diabetes. So at the end of the day, it's another type of calorie that our body is seeing that isn't ideal and isn't complex in terms of our body needing to break it down. Beer is going to be the worst offender and has the most carbohydrates and, has usually the most volume. And then it depends on the mixed drink or wine in terms of the sugar consumption. But something to be cognizant of. When I see elevated triglycerides, which are going to be something on your blood workup with your cholesterol, you've got your LDL, the bad cholesterol, your HDL, the good, and then the triglycerides, which are usually these days when they're high because somebody has untreated diabetes. And the first thing I will talk to people about usually is beer. And here in Minnesota and Wisconsin, cheese curds.
Cheese
Cheese
curds.
curds. Oh, I would know. Oh my gosh. I love cheese curds.
Ooh, the
It's tough.
squeakiness just gets me. I can't take it, but
I know you were talking about squeaky cheese the other day, and you were like, I can't do it. Just can't.
so
But so good.
yeah. So the last thing I would like for you to comment on, especially from a preventive perspective, is smoking. Not necessarily only cigarettes, but other things too. So if you wouldn't mind letting me know your thoughts about smoking.
Well, that's a really good question. So smoking is going to be, in my mind, smoking cigarettes is basically smoking and morbid obesity are the only two things I usually see young people in their late 20s or early 30s having heart attacks for. And so, we've gotten our smoking rates in Minnesota down pretty low now. So we're definitely seeing less of it. But I'm sure, like yourself, Dr. Keller, that's who you see with these unpredictable heart attacks at young ages, unfortunately, is smokers. And as I always tell people that smoke, you've got, two different risks. You've got, and I've literally seen this, somebody in the hospital goes outside, smokes one cigarette, breaks off a piece of plaque and has a heart attack and comes in. You have the long-term impacts of plaque and hardening of arteries and the lung impact. So sometimes I think people think they only have to worry about those long-term ones, but every time you're smoking a cigarette, you're having a spasm in your artery that could break off a piece of plaque and cause a heart attack. So
wow.
You've got that, number one. Yeah. And then as it relates to marijuana and other things, as you're mentioning that you can smoke, it is tricky because part of the challenge with marijuana, right, is that a lot of time people end up eating more and getting talk about, which unfortunately is then going to be increasing the blood sugar, increasing our risk of diabetes that way. So the problem otherwise with marijuana is the inhalation and the impact on the lung. I haven't seen as much dramatic impact on heart disease yet, but it hasn't been studied that way. So that'll be really
well, and that brings us to vaping. I do heart and lung surgery on people every day. And people are always amazed when I tell them that your lungs are like tissue paper. They're very fragile. And once you destroy that lung tissue, it will never come back. There's no regenerative propensity for the lung. So when you inhale carcinogens, and there are very few things we know with great certainty in medicine, one of them is that smoking causes lung cancer and heart disease. Smoking anything causes lung cancer and heart disease, including marijuana, which is unfiltered, and the number of toxins in vape smoke is astounding to me. And so it's really important to get people to understand that if you're going to have some sort of a vice that includes some sort of nicotine or THC or whatever you feel less you need to be able to get you through the day, if you eat it, it's a little bit less harmful to you than if you smoke it.
1,000%. Yeah, I think that's really critical. Yeah, it's so interesting. I don't know if you guys see this, but I know with my son, they're just blown away that people smoke. They don't see it the same. And we have, and hopefully that's what will happen. You can't smoke in any of our bars here and things like that. They don't much, but you feel for people who've gotten addicted over the years because it's so tricky.
Yeah.
So we don't want people to
Well,
start. And go ahead, yes.
yeah, that was the trend for a long time where fewer and fewer people were smoking. But lately, we have had an uptick in the number of teens and people in their early 20s and 30s that are smoking. And it is really interesting to see the volumes of people who are young people who are smoking cigarettes and certainly vaping too. It seems to be a very trendy thing to do. So it is, we have to keep fighting that fight because it is very important for people to realize. And one of the things that I had to tell someone today in the clinic was that there have been a number of studies, including one study from the VA hospital that looked at veterans who smoked, and they determined that you have to smoke 100 cigarettes before it increases your risk of developing an aneurysm. But it is a significant increased risk of developing aneurysm from only 100 cigarettes. So it's really important to get people to understand that even one is not necessarily good for you.
Yeah, yeah. It is so true. And definitely vaping, I was at the Minnesota Department of Health, and we actually had to put out warnings because we were seeing so much with teenagers in terms of these bizarre lung infections from crazy flavors and whatnot added, and are clearly directly going after these youth when they're like Sour Patch Kid flavored or whatever thing.
Yeah.
Yes.
With these smart
Tragic.
youth, they come back with, you can't buy us that way, right? I mean, and it's the same thing with menthol cigarettes have been disproportionately marketed towards people of color for decades now too. So
Yes, it's again about that access issue with those disparities that ties into the healthcare in the end. And it's really devastating to see how many children, in America are now dealing with these heart and lung issues, and they're so young. I feel like you were able to talk, both of you able to speak about different patients' experiences that you've had. So can you talk to the community, Dr. Jordan Baechler, about what point does a patient see a preventative cardiovascular care physician versus a cardiologist? Because at first I thought it was the same thing, and then I looked into it before this chat and learned it's quite another different story.
It's another sort of confusing thing. So, those of us that practice preventive cardiology have gotten some type of extra training. So it's not a board certified specialty yet, but most of us did either training in public health or population health or lifestyle medicine or all of the above. So where we exist, I think it's an opportunity to have someone look at your health, at your cardiovascular and cardiometabolic, including diabetes, with a fine-tooth comb of how you can stay healthy the longest, ideally from a preventive perspective. So most of us still see, it's not uncommon that I see people after they've had bypass surgery or after they've had a heart attack for secondary prevention. But I also see people as young as 18-year-olds who have some type of family history, sometimes as simple as just high cholesterol, or somebody who they have a strong family history of a heart attack in someone young. So, again, you see basically really savvy people wanting to get their risk reduced as small as possible. Of course, I have a bias that way, but I think if you have the opportunity, if you have preventive cardiologists where you're at, it's a great opportunity with how fast-paced medicine has gotten to just have someone look at you with that lens. So the earlier, the better. And they're really, of course, insurance can be crazy some places, but we here in Minnesota have pretty good coverage that way. So if you have any condition that we can bill for, which in this case, family history alone is something that way, you can usually get covered. So.
Wow, that's really interesting to hear that kind of anyone at any point in time, if they feel like they need to focus on that preventative care, they can.
Before we go, Courtney, I would like for you to tell us one thing that you would like to tell everyone in the community about preventive health as it relates to cardiovascular disease and chronic disease. And if there is one message that you could give them that you think is an important message to hear if you have risk factors for these kinds of cardiovascular problems.
Yeah, well, I'm going to steal a line from my health equity fellow this year, about Thomas. Amazing. But she, in an amazing presentation she did, she said, it might not be your fault, but it's your responsibility to continue to work on prevention and treatment. And what I like about that is there's a lot, especially from a racial perspective. We know that racism alone directly increases your risk of developing high blood pressure, high cholesterol, heart disease. So there are all these things that it is not fair the way they show up in this world and impact each of us. However, it is critical that you know what your risk is to be able to make an informed decision, because that you actually have a lot of control over in terms of what the outcome ultimately is, whether or not you end up with a leg amputated or potentially bypass surgery, all these end things, right? And so there's not shame in that for anybody that's listening that's had that. That is not the point. The point is how we minimize folks having these going forward. And we know we can do a better job at prevention, but you don't know what you're preventing until you know what your actual risk is. So I think sometimes people are scared to have conversation and to find out what is or isn't there. But an ounce of prevention is worth a pound of cure. So.
Yeah, I think that's a really important point, that just because you're scared, that doesn't mean that you still don't need to follow through, because definitely early intervention is paramount, because if you can catch someone before they develop irreversible disease, then it's something that can be taken care of and give them the same long health and life expectancy that they would have had otherwise.
Well, thank you both so much for your time today. And I mean, we kind of went over a breadth of different topics in terms of heart health prevention, diabetes, and how those two can tie in together, along with learning more about mitigating any kind of risks at this point. And a fun fact about what we can do for the holidays and keeping things in moderation. So thank you so much, Dr. Keller and Dr. Jordan Baechler, for your time. And I hope, Dr. Jordan Baechler, you have a nice holiday season and that we can have you on the Pulse again soon, and hopefully to work on women's heart health in the new year.
Absolutely. Count me in. Thanks so much, you guys.